How did mental health change during the pandemic? Well, COVID-19 pandemic took a major toll on mental health. In the United States alone, clinical rates of anxiety and depression rose nearly 400% during the pandemic. And like a lot of things with the pandemic, the costs were not equally shared. Parents, mothers especially, saw the largest increases in psychological distress. And worse yet, estimates show that rates of mental illness and psychological distress remain as high today as they were during the early days of the pandemic. In the US, gender disparities in psychological distress are longstanding, with women exhibiting poorer mental health on average than men. And these disparities widened during the pandemic. Now, a primary reason for this was that women were more likely to be exposed to pandemic-induced stressors than men. Women suffered greater job loss. As household managers, they did the majority of mental and physical labor, domestic labor in particular, during the pandemic. And so this meant greater increases in time spent in childcare, educational responsibilities in particular, as well as more work-family conflict. Additionally, as the keepers of family health, women were more worried about COVID than men. And this also led to greater stress. Moving forward, reducing gender disparities in mental health that predate the pandemic and that were also exacerbated by the pandemic entails reducing gender disparities in domestic labor, aiding women's return to the paid labor force, and enacting family and workplace policies that alleviate work-family conflict.